Today, Orange County Mayor Jerry Demings will discuss Orange County employee vaccinations and, of course, coronavirus cases and vaccine efforts countywide. The mayor will also present information on emergency rental assistance, redistricting, and an effort launched today for our seniors. Dr. Raul Pino from the Florida Department of Health is also here and will report on important COVID-19 trending data here in Orange County. In addition to that, today we have some very special guests with us, Dr. Kenneth Alexander and Dr. Adriana Cadilla, both infectious disease specialists from Nemours Children's Health. Welcome to you and to your team who has joined us here today. After Dr. Pino, Drs. Alexander and Cadilla will discuss upcoming vaccines for children and how parents can prepare for when those vaccines do indeed become available. We will begin our press conference, as always, with Mayor Demings. Mayor?
All right, good afternoon, everyone. Thank you all for joining us as we come to the end of another week. Today marks some historical milestones for us. First off, this is our 160th news conference since we began coming to you and briefing you regarding this pandemic. Also, today is the deadline we have set for all Orange County employees to have at least one or more shots of the vaccine. And I'm happy to report our total number of employees who have complied with the directive is at 86%. That was a goal of my mandate, to keep our employees and those we serve as safe as we possibly can from the coronavirus. When we look at the overall numbers of our employees, 95% of our non-union employees comply with that directive, 75% of those within the union. When I declared the state of emergency most recently on July the 28th and issued my vaccine directive, I knew our employees would step up and respond in a significant way to getting vaccinated, and they have done just that. I'm happy to report that, in fact, we have signed a COVID-19 policy agreement with local members of the International Association of Firefighters, or the IAFF, over the vaccine mandate. As you all know, all of our other unions had already entered into agreements with us. And so that is good news for Orange County. That is good news for our residents. The agreement requires union members to certify their status, as well as all employees of Orange County to certify their status by today, whether it be for a first dose of Pfizer or Moderna, or a single dose of the Johnson & Johnson vaccine, or by submitting an accommodation form. As is the case with other county government employees, firefighters will get a day off for complying with today's deadline. If county employees submitted their vaccine forms by August 31st, they were to receive a $250 payment. Again, my goal was to incentivize and not penalize our employees as we instituted a vaccine mandate. This effort makes employees and citizens safer from contracting COVID-19. If they do not submit their forms by today and remain unvaccinated, they shall be subject to required weekly COVID tests, along with individuals who have submitted their accommodation forms. All county employees who fail to submit accommodation forms or COVID-19 documentation will receive written reprimands. And as we introduce our physicians from Nemours earlier, as parents with children under the age of 12, we all know that at this time there is no vaccine currently available for them. Pfizer has submitted research to the Food and Drug Administration on the effectiveness of its COVID-19 vaccine for children, but the shots may not be available until November or December of this year. Because there has been so much uncertainty about the vaccine for our youngest children, our youngest residents, we have invited medically qualified experts to join us here today who will speak to related matters. We welcome pediatric infectious disease specialists from New Orleans to help us and help our community in educating with verifiable information. We look forward to hearing from them in just a few moments. So let me give you an update on the numbers here in Orange County. There are now 227,004 coronavirus cases reported in our county. Over 227,000 people have contracted the disease in our county. That's a sad milestone for us. The number of Orange County residents who have died from the COVID-19 has now reached 2,000 deaths here in Orange County. That is up 32 fatalities since we last spoke on Monday of this week. On the positive side, we are continuing to see a downward trend in the 14-day positivity rate, which today is at 8.39%. The last time the positivity rate was 8% was in mid-July. You all know the pinnacle that we are striving for is to get that number at 5% or below. Once we hit a sustained period of time where that number is 5% or less, we will not be under a state of emergency at that time. For the 11th day in a row, daily new coronavirus cases in Orange County are below 500. According to yesterday's numbers, 272 new cases were reported through the Department of Health. Now I'll talk a little bit about the vaccines. On Tuesday, the Pfizer booster shot started being offered at our Camping World Stadium vaccination site and at all Orange County sites where our mobile I Got My Shot operation is moving around. As a reminder, the Pfizer booster shot is available to those 65 years and older and also for those 18 and older with underlying medical conditions. The booster is given at least 6 months after individuals receive their full vaccine series. So far, across Orange County, 1,762 citizens have received their third booster dose of Pfizer in the past 3 days. Dr. Pino will share more about the details. You can also get your free first or second dose of either Pfizer or Moderna at the Camping World Stadium location. The I Got My Shot vaccine trailer will be out tomorrow and Monday at Goodwill locations. Tomorrow morning, the mobile vaccine unit will be at the Goodwill in Lake Nona off of Narcoossee Road. On Monday morning, the shots will be given at the Goodwill outlet in the Pine Hills area on North Hiawassee Road. To find out more information, you can go to our website at ocfl.net/IGotMyShot. Our 3 testing sites continue to operate 7 days a week, and combined, the sites are averaging about 1,600 tests a day. The Barnett and the former Claricona Elementary School sites are open between hours of 9 a.m. and 5 p.m. The Econ Soccer Complex site is open between 9 a.m. and 4 p.m. You can get information by going to ocfl.net/testing. We continue to offer emergency rental assistance through our program here within Orange County. To date, more than 1,757 families have qualified for help with their rent and have avoided eviction. More than $9.7 million have been approved for distribution to those families. Residents can also get information on the rental assistance program by going to ocfl.net/rental assistance. And a quick reminder, the next Orange County Redistricting meeting will take place next Thursday, October the 7th, at Barnett Park. It was originally supposed to be here at County Administration, but we're taking the show on the road. It will be at Barnett Park next Thursday, October the 7th. The meeting will begin at 6:30 p.m. This week, on our website, individuals are able to go to the website at ocfl.net/redistricting. We launched an online tool where citizens can draw their own redistricting maps. With this mapping tool, residents can review the census data by district and draw up new county district boundaries to submit to the advisory committee for redistricting. And now, let's see, we'll move forward. Earlier today, we had the opportunity to visit our Taft Community Center, and I want to take a moment to talk about an initiative we launched. That initiative is called the AARP Livable Communities Program. The goal of this program is to create an age-friendly place for seniors to live and recreate. Nationwide, the 65 and older population has grown by 1/3 over the past decade. Orange County is no exception. Florida is the second largest state for AARP membership. We have created a survey for our seniors and others that is to gather information about the experience of those who live in Orange County to ensure that we are taking care of all of those from the youngest to the seniors, but more specifically with this initiative, it's about the seniors. So we are asking the seniors questions about what type of community they want to live in, what are their amenities, what are their needs, so that we can make appropriate adjustments. And now Dr. Pino will come up, and he will be followed by our pediatric physicians, Dr. Kenneth Alexander and Dr. Adriana Cadilla. And Dr. Pino, you're recognized, sir.
Good afternoon, Mayor. Good afternoon, everyone. I'm going to be a little bit brief to give time to our pediatricians who have a lot of information to share, and we know that it's about time that we share this type of information, as maybe approaching the time where 5 and older could have access to the vaccine. As the mayor mentioned to you, we are at 227,004 cases in our county, and we have reached a sad milestone of about 2,000 cases, and I say about, but it's constantly changing. Our positivity rate is 8.3%, and this is the 6th consecutive day that we are below 10%, and the 11th consecutive day that we have less than 500 cases a day. Right now, we are in average less than 300 cases a day. For the number of deaths that has been reported to the state since we talked to you on Monday, that number is 32. There are 14 female, 18 male. The race, 1 Asian, 1 Native American, 7 Black, 22 white, 1 of other race. For ethnicity, 7 Hispanic, and 25 non-Hispanic. 18 of those who were reported death this week had a pre-existing condition. 14 we do not know. 3 of the deaths are from August, and 29 of those deaths are from September. 4 of the 32 deaths, and that is 12.5%, were residents of long-term care facilities, and 6 of the 32 were fully vaccinated. 2 of the 32, and that is 6.3%, were partially vaccinated. For those who were fully vaccinated, the number of days between full vaccination and the disease is 6 months, 181 days exactly. And for those who were partially vaccinated, 1 was past due their second dose, and 1 was not, still not due for the second dose. With regard to death, the number for August continues to be the highest ever. This is 408 cases for the month of August. The highest that we had before was January this year, and that was 228. So we have basically technically doubled that number. And for September, we are at 148. Although the month is ending, remember that we always see some struggling cases alone because of the approval process that the state has in place. And also the median age has reduced a little bit to 69 by 1 year. It was at 71, then 70, and for both August and September is at 69. July was at 7.5, Although that variation doesn't seem much, it's an indication that younger people have died from the disease, as you see that number go down, although it takes a lot to change that number a little bit. For the vaccination, the good news is that our percentages continue to increase. Our one dose for residents eligible is at 75%. And in some groups, we are over 80%. Specifically, we are doing great among people who are 65 years and older, and those are the most vulnerable with, of course, other individuals with pre-existing condition. I'm going to give you a quick, our average is 75.1 for the entire population. That is 133,537 individuals. For 12 to 17, we continue to increase. That is at 66%. Remember, a few weeks ago was at 20% when we started. For 18 to 24, we are 64.4%. For 25 to 34, we are also at 62%. For 35 to 44, we are 78%. 81.4% for 45 to 54. 55 to 64 is at 83. And as I mentioned, 65 plus is at 87. Again, there's still time to get vaccinated. There are a few holidays coming. We should be prepared, and parents should prepare to vaccinate their children as soon as the vaccine becomes available for 5 to 11 years old. With that, I will pass the microphone to Dr. Kenneth Alexander from Nemours.
Thank you, Dr. Pino, Dr. Demings, Mayor Demings. Before I begin, I just want to be clear, I've served as a consultant for Moderna. There are few things right now that lead to more controversy than a discussion of COVID vaccination. And so as I begin, I really want to start with a plea for some compassion around the vaccination topic. Compassion for people that have COVID, compassion for people that have lost family members or friends, and especially compassion for people who are trying to do the right thing and yet still aren't absolutely sure what to do. Because we all want the same thing. We want this pandemic over. We want it over with our family and friends healthy. We want to do the right thing for our children. We want to see our businesses up and running. We want our tourists back. And I want to get rid of this damn mask. We want to get life back to normal. Unfortunately, SARS-CoV-2 had other ideas in July, and we saw the emergence of the Delta variant. And as Dr. Pino has just shared with us, the ravages of Delta have exceeded anything that we have seen so far. Not only because it seems to be more infectious among our adults, but because it's also played an important role in infection among our children. So what do we do? Well, we know the tools that are available to us already, because they're the same tools of public health available for every pandemic. Hand washing, social distancing, masking, testing, quarantine and isolation, vaccination, and herd immunity. Now, a word about herd immunity. There's no doubt it works, but it's very, very expensive. 660,000 Americans couldn't wait for herd immunity, and their families wish they had a vaccine. And in Orange County, 2,000 of our friends and neighbors didn't get vaccinated and couldn't make it. So vaccination is still the best tool we have, because no one has to die to get immunity. How effective are vaccines? We know this. We used vaccines to eliminate smallpox. Vaccines have chased polio from the Western Hemisphere. We are on the cusp of eliminating cervical cancer from our society with vaccines. And I suspect Dr. Pino and I are the only two people in the room that have seen anybody with measles. Now that's a double-edged sword, because while we've eliminated these diseases, one of the things we now deal with parents is that when they don't fear the disease, they fear the vaccine. And yet we know that the ravages of all these diseases far exceeded any risk of vaccination. And that's why we're talking about COVID-19 vaccination today. As Mayor Demings already mentioned, Pfizer yesterday has turned their data over to the FDA for evaluation of vaccination for children from ages 5 to 11. The data have not been released publicly yet, but we are eager to see their immunogenicity and safety data in young children. We look forward to an expert review from the FDA. Are we excited? Yes. Do we anticipate that this is going to be a game changer in the COVID pandemic? Absolutely. Because one of the things that we're seeing is with the emergence of Delta variant, the virus is behaving more like what we are used to seeing with influenza, where schools are an important focus of infection. But for this to work, we've got to get people vaccinated. Vaccines in vials don't help anybody, right? Vaccines have to go into the arms, and especially now, into the arms of the people we cherish most, our children. And so as we talk about immunizing children, we know from experience with all other vaccines that parents only want to know three things. Does it work? We'll have those data from the FDA and Pfizer in the next 2 weeks or so. Is it safe? That's why the trials have been done. So far, safe in all other age groups. Does it work? Again, we'll have those data, but as many of you have heard already, if we look at who's hospitalized with severe COVID, 98% of those people are unvaccinated. The trouble, of course, now is that we're hearing the phrase, even from our president, saying that this is now a pandemic of the unvaccinated. And that takes on many different tones. In part, it's a tone of anger. It's like those of us who are vaccinated saying to the rest of you, get with the program. But I think that's a divisive approach, and that's not going to help anybody. So what I want to talk about for just a few seconds is, what does a pandemic of the unvaccinated mean? Because what I think we have to do is talk about this with compassion. My fear is that the unvaccinated are those who are going to bear the burden of this pandemic from here on out. They are the ones that will bear the grief, the loss of family members, the uncertainty of, should I have vaccinated that family member? Maybe I should have. And the daily uncertainty of, am I going to get COVID today as I go to work and do the things I do? It is their children that will fill the beds in our children's hospitals. So what can we do? Our goal, of course, is to protect everyone. We are all God's children. If you are vaccinated, then celebrate. You've done what you can do for your children, for yourself, for your family, and your community. You still need to wear your mask, because we know vaccines don't always prevent infection, they attenuate disease. But the other thing is, share your experience. Dr. Kadia is going to share a little bit with you about what it's like to be vaccinated and sort of the liberated feeling that we experienced. And make sure that the rest of your family are vaccinated. If you're not vaccinated, continue to wear your mask. Continue to social distance. Avoid crowds. Wash your hands. Stay away from at-risk people. And importantly, continue to seek good information. And therein lies one of the problems right now in our country, is that the good vaccine information is being diluted with bad vaccine information. Dr. Pino and many of us will remember in the AIDS pandemic billboards that said, for HIV, silence equals death. For COVID-19, misinformation equals death. So call out misinformation when you see it. Get tested. All of us should get tested. Because if we can't use some of the other tools available to us, vaccination and testing are especially important. So to close out, again, we know what parents want to know. It's the same for every vaccine. Is it safe? So far, in other age groups, absolutely, and we anticipate the same in younger children. Does it work? Absolutely. Does it work every time? No, but almost every time. And finally, what's our recommendation? And across the medical and public health community, the recommendation is vaccinate. Vaccinate your kids. This is how we're going to get out of this. But to put it another way, I'm vaccinated, my wife is vaccinated, my daughters are vaccinated, my parents are vaccinated, everyone I care about is vaccinated. Because in the end, I want you to think of vaccination not only as a public health measure, but as a gesture of love. Right? I sometimes joke with our pediatric residents, only vaccinate the children you love. But in fact, I'm deadly serious about that. Right? That's how you express to your children the fact that you care about them, the fact that you love them. This is what responsible parenting and membership in a community is all about. So with that, I'd like to bring Dr. Kadia up. Dr. Kadia is my colleague at Nemours Children's Hospital and other infectious diseases consultant. And Dr. Kadia, in addition to being a very smart infectious disease doctor, is a mother of 2 young children. And I think she's going to give you a look at what her life is through that lens. Dr. Kadia?
Thank you, Dr. Alexander, and thank you, Orange County Mayor Demings. Thank you for the invite and having us here talk as pediatricians. This week was a week that we had been anxiously awaiting. We were waiting for that data to be submitted because as pediatricians, as Dr. Alexander just stated, we vaccinate. That's what we do, right? As you recall, taking your kids or when you were younger, that was one of those things you always just had to do. Go get your shots. So we're very hopeful that soon we can extend this vaccination to those 5 and up, hopefully even those younger than that, maybe by our winter time, by the holiday season. But one thing we do have to remember is that this may be a little different this time. The logistics of how this vaccine is distributed may need some help from the parents. And that's something that I've already started to do with my children because they're eagerly awaiting their vaccine. They are 6 and 8 years old, and we can't wait to get the vaccine. But I've been talking to them about the fact that it probably won't be available at their pediatrician's office. We need to start letting them know it might occur at a pharmacy, at a drugstore, someplace they're not used to going. And so, but by letting them know this is coming and this is safe, this is what we do, this is how we do it, they understand this. Really, kids follow us and they look for our lead. It was a very emotional moment. I remember when I got my first shot, it was around the holiday times, I cried. My second shot around my birthday. It was a wonderful feeling, and I can't wait for my children to be able to share that too. As we've just said, the vaccine appears to be the best tool we have to get us out of this pandemic and be able to return to things as they were. It's important as parents, if you have questions, talk to your pediatrician, talk to your healthcare provider. Make sure you get those questions answered. We're here to help. And remember, it might not be at your pediatrician's office, but wherever it is that you do get your child vaccinated, that's what we're here to do, to help. So any questions you may have, we'd be happy to help you with those. Thank you so much. And I believe Mayor Demings, I did the same thing. Something else to add?
No, I'm not a doctor. I just play one on television. Anyway, thank you, Dr. Kadia, and to Dr. Alexander for joining us today. We will make them available for any questions, but we also are joined by Commissioner Gomez-Cordero today and If we need to do any translation in Spanish, we have Ms. Ilia Torres. We also have from the Orange County Public Schools, if there are any questions regarding the schools, Mr. Scott Howard is here. I have my HR director who came in, who has been engaged in some of the union conversations, and we have Dr. Yolanda Martinez, our health services director. And with that, we'll open it up to any questions. There will be a microphone here in the room that will be moving around, and we just ask that you wait on the mic before you ask your questions. And we'll start now.
Steve Hudak from the Orlando Sentinel. I appreciate the two doctors being here. I don't have questions for them, though. I have a question for you, Mr. Mayor, or for Ricardo. Do we know what percentage of Orange County workers, staff, were vaccinated before July 28th when you yeah, that's like the $64,000, well, the $5,000 question, I guess.
Well, I think before the mandate was put in place, we had no real requirement for our employees to report on whether or not they have been vaccinated or not. But Ricardo, is there a definitive number that we can offer at that point?
We have not requested when a person was vaccinated as far as the data was collected, so we don't know when the employee may have been vaccinated before or after.
So we don't have that information. Again, we have not required our employees to produce their vaccination cards. They've only had to attest that they were vaccinated. So unfortunately, we can't give you a precise answer on that today.
Lauren Seabrook, Channel 9, Mayor. Can you tell us what it took to get this agreement with the fire union today, and if there are any conditions that will be different for union-represented firefighters versus other Orange County employees?
The agreement with the IAFF is consistent with the requirements that we have made for all county employees, and all county employees who followed the mandate by the respective deadlines, there's no disciplinary action for them. Those who will fail as of today to get vaccinated, they'll be subject to a written reprimand. And we'll provide a copy of the agreement that was signed by the local president of the IAFF, Local 2057, and our county labor council signed the agreement earlier today. We'll provide you a copy of it with the details so you can see some of the salient points, but essentially those things that I previously announced on Monday are within this agreement. Any other questions regarding that? Okay. Okay. No other questions? Okay. Well, okay. One in the back.
Hey, this is Melissa Thomas with Florida National News. So I wanted to get Dr. Pino, this one's for Dr. Pino. I wanted to get your thoughts on that, the announcement with Pfizer submitting their research in terms of making the vaccine available for the younger patients, if you will, for the younger generation.
So, the clinical trials for that age group was completed. Part of the process is also determining safety, but also determining dose, how much you have to give. Is it going to be the same? Is it going to be less? In many cases, medications are gauged by weight, by body weight. So that may be part of the submission that is in there. As the doctor says, great news. This is a segment of the population that, although they have decreased tremendously the number of cases in student-age children, they continue to be about 19 and 20% of the cases. So the pandemic is really, we are in a very good place for every single age group. but they all continue to be represented about the same percentage. So meaning that if a situation with another variant were to come, or any other situation that may develop, this age group could be effective as much as it was before. So it's critically important after this process gets completed to vaccinate our children as soon as possible so that they can continue to safely go into school. Our population in that age group is about 126,000, a little bit over 126,000.
Jeff Allen with Spectrum News 13. This question actually for Dr. Pino. I was just wondering if you, what you feel like is either the biggest or the couple biggest things that are driving these numbers back down. I know your all's level of what you expect a herd immunity would be is up in the 80s as far as vaccination rates, but with numbers going down at this point, what do you feel like is really the biggest thing pushing that?
Some people are arguing that there is a natural cycle of this pandemic, that it goes up and down at specific times of the year. And I'm saying this because we don't know these pieces. Some people have seen some correlation between the times that we go indoors, which is in the southern part of the United States in the summer, in the northern part of the United States is in the winter. So watching this winter and what happened in the Northeast and other areas of the country is going to be critically, epidemiologically speaking. Although the North seems to have better vaccination rates they achieve higher vaccination rate faster than we did. So there is some protection there. But I think it's a multi-layer approach. If you look at the data, it's quite interesting. For example, we can see when the monoclonal treatments started in our county, and the next day we saw a decrease in hospitalizations. And this is a treatment that is intended to decrease hospitalizations. So immediately after we saw that. We also have seen some changes in the number of infections after the school placed the mandate on mask. But people could argue that the infection was already going down. And what we have explained to the public before, this is not a one-shot thing. You have to have a multi-layer approach, which is the best. Is then when you get to clinical intervention, those are the vaccine and the monoclonal treatments, and those are there to provide us with the safety that we need.
Okay, thank you all for coming. The next press briefing that we have scheduled is scheduled for Monday, October the 4th at 11 a.m. So we hope to see you then and give you an update.